It may lead to a higher risk of them developing mental health problems. That's according to a new study. And tonight we're breaking down the research and sharing what parents need to know. Concussions and kids' mental health. New research suggests a link between the two.
Some of the primary symptoms after a concussion can include things like changes in mood, anxious thoughts, changes in behavior, irritability, that sort of thing.
The Canadian study published in JAMA Network Open examined records over a 10-year period starting in 2010. It looked at kids between the ages of 5 and 18 who had a concussion or orthopedic injury. None had a mental health diagnosis before being hurt. Researchers found that concussed youth had a 40% increased risk of developing a mental health issue compared with children the same age and gender with an orthopedic injury. Those who had a concussion also had an increased risk of self-harming and undergoing psychiatric hospitalization. Pediatric neuropsychologist Kelly McNally says parents should be aware.
I think a primary thing for parents to do is just to keep that conversation rolling with their children. So if they have had an injury, ask them, how are they feeling? How are they doing emotionally? How are they coping?
If there are any red flags such as mood changes, being withdrawn, or your child isn't enjoying activities they once did, McNally says get help.
We don't want parents to be afraid for their children to play sports, but it does provide information to parents to help empower them to help get the right help for their children if they are seeing mental health symptoms after something like a concussion.
And McNally says it's important to seek care early if there are any concerns about mental health problems. She says issues can be treated more easily and quickly if those symptoms are identified early.